This conversation focuses on some extraordinary services in LA County you might not know about. Services that help build community wellness and bolster mental health. Services around the arts. Our moderator is Elisabeth Nails. She's a program specialist with the LA County Department of Arts and Culture. Our panelists are Miguel Drayton, Instructional Designer at the UCLA Prevention Center of Excellence. Rebeca Hurtado is the Mental Health Program Manager for the LA County Department of Mental Health. And Stephany Romero, Psychiatric Social Worker, Los Angeles County Department of Mental Health Prevention Unit. Thank you.
Hello, my name's Elisabeth Nails. I use she, her pronouns. I'm a program specialist for the LA County Department of Arts and Culture, and this panel is advancing community wellness through mental health and the arts. We had hoped to share this conversation live, but we all, I think, agree that we wanted to come together in this time to be present and to still share this conversation and start to make sense. Because we're amidst polycrisis and mental health matters. And the arts provide different ways of bringing community together and building connectedness around and through trauma. So for this conversation, we're going to focus on schools, families, on mental health, on professional development and capacity building for the field, and we're going to share about partnerships and collaboration and strategies that enable us to do that. We hope this conversation can help you make relevant connections between this work and your own work that you're doing in your own communities and for LA County's diverse communities. So I'd love to go around and please introduce yourself and briefly tell us something about your work and what's one way that you cultivate your own creativity.
Hi, I'm Stephany Romero. I'm a licensed clinical social worker and currently working for Department of Mental Health. And I've been in the mental health field for more than 10 years now. First starting with just like one-on-one with children and families, and now just doing a more administrative role, but still really in the communities and taking care of, just the resources and providing that for our communities and being able to spread the word on mental health and creating that awareness. And so how do I cultivate my own creativity? I think that I'm just a colorful and upbeat person, and so I like to just drop that everywhere I go and in everything I do. So every work that I do is like I'm doing it with a smile on my face, hoping that the person seeing it or hearing it has a smile on their face as well.
Hi, my name is Rebeca Hurtado, and I'm a program manager with the Department of Mental Health for the School-Based Community Access Point program. A little bit about our program briefly. We kind of work as liaisons between our department, our contracted mental health agencies, and their schools to ensure that the schools and our students have access to mental health services. And our unit also does a lot of workshops for students and caregivers. And how do I cultivate the arts in my field at this time really is putting a little bit of myself in some of those workshops, or when there's speaking engagements with the community. There's a lot of cultural events that we participate as the county, so to ensure that I can connect with the community and make it fun, and also kind of ensure that mental health becomes less of a stigmatized issue. Thank you.
And my name is Miguel Drayton. I'm an instructional designer with the UCLA Prevention Center of Excellence. The UCLA Prevention Center of Excellence is also known as the COE, and we actually provide coaching, training, consultation to LA County employees, especially in the area of mental health and well-being. We have an online learning center that I'm happy to brag. We have over 60,000 users on our online learning center with over 1,000 different learning assets, from courses to videos. When people ask me about what kind of work I do, and I say I'm an instructional designer, they ask what's that, and then I normally say, well, I design instruction, and then there's a kind of a long pause, an awkward end to the conversation. But to explain kind of what that is, might be helpful to give a bit of background. My background is in filmmaking, screenwriting. I was an instructor for about 20 years in the visual arts, and I remember one day in one of my screenwriting classes, the students, this was about 10 years ago, at the break, rather than take off to use the restroom or basically like, go get a snack, they stayed in the class and they were on their phones. And I thought, well, maybe I should be running my class on the phone because then the students will be hanging out more often. Fast forward to 5 years later, I did a career pivot into instructional design where I actually employ various artistic tools from my filmmaking background and also technological tools in AI and VR to create online learning experiences. So I hope that kind of gives a bit of a background and also an explanation of what instructional designers can do in this space. As for what I do personally to, I guess, creatively, I actually am quite fortunate that in my day job, I do that all the time. I feel quite fortunate, especially when I'm working with Rebecca and her team at DMH, that I'm employing my filmmaking skills, screenwriting skills, working with editors, and it's kind of creative bliss. So I feel quite fortunate that in my day job, I don't have to separate, what I do creatively from what I do professionally.
Thank you so much. It's wonderful to hear more about you all. And let's dig into this conversation deeper. It's really great to have folks who are doing this work day to day to share your perspectives. So I'd love to hear from you. What do we mean when we are saying that we're advancing community wellness through mental health and the arts? Miguel, do you want to kick us off?
Sure. Thank you, Elisabeth. I think for me, when we say that, we're actually acknowledging that well-being doesn't just happen in clinics or in a clinical setting. That mental health just doesn't happen in a clinical setting. It happens in our community. And with regards to the arts, I can speak, specifically what we do at the COE. We actually, our work is based on a trauma-informed lens. And there are actually five components to that. I'm not a clinician, but there's one that stands out to me with regards to the arts when having interpersonal interaction with someone, and that is empowerment and choice. And I remember from my days as a screenwriter, I'm a recovering screenwriter, that the process of being engaged in something creative is quite empowering, and having those choices, regardless of the actual outcome of what I create. In that moment, I'm in control. In that moment, I have choice. And that means a lot for my mental health, and I think that a community that has that opportunity to be engaged creatively is a community that's been provided with empowerment and choice.
Thanks, Miguel. How about you, Stephany?
I think when we think of advancing, we have to think about also before we advance. And I want to point out the stigma that there was with mental health. And honestly, to this day, there is some people still very skeptical about it, right? Mental health means I'm crazy, when really, not really, right? We all experience mental health. Right now in this very room, we're excited, we're happy, we're showing emotions, right? And so that's mental health. And so I think that stigma is still kind of carrying over. So I feel like in order for us to advance, we need to be able to think outside the box. We need to be able to bring different things into the table, right? So for example, arts, and bring that into mental health and collaborate it together in that sense where it's like you're conducting mental health strategies and tools, but it's through the arts. And I think that will help others be able to accept that mental health is here and it's a thing, right? And something that we can provide that support for.
Thank you. I'd love to layer onto that we're at this exciting moment, and I think this summit is more evidence of it, that mental health and artists and culture bearers are coming into more and more conversation. And artists and culture bearers have been doing healing work for a long, long, long time. And as you said, it's through the collaborations. There are so many ways for healing and for cultural relevancy. So this is such a powerful part of advancing it through arts and mental health. So we've heard a bit about what we mean by it. Now can we talk about who's doing this work and how? Rebecca?
Yeah, of course. In the Department of Mental Health or our clinics, for a long time, we have used arts as tools or mechanisms to be able to connect with our clients, especially children. You have art therapy, you have music therapy, and also you have the homework assignments like journaling and drawing. So you have your clinicians, you have your clinics, your, quote unquote, like traditional groups that are doing this. But in the last few years, thankfully, there's been more of a belief or a little bit of a shift, and we're looking at that the art itself, the process of doing art can be therapeutic itself. And as you had mentioned, there are many artists that already have been engaging in this for a long time and trying to use it as a wellness tool, like not just drawing and writing, but also movement, painting, and just even comedy to an extent. So when it comes who's doing it, is also our non-traditional nonprofit. We have, for example, partnerships with Wolf Connection, partnerships with Creative Wellbeing from the Department of Arts and Culture, partnerships with UCLA, and also partnerships with the Music for Your Mental Health programs, in which these partners are helping us in the department to learn ways of new skills to use the arts in our work, but also see the arts as therapeutic in itself. So to answer your questions, to be honest, it could be everybody. But currently it's really our clinicians, but we're kind of moving or changing the box that other things or other people can help us in the wellness.
Thank you. How about you, Miguel?
You all are doing the work. We're also doing the work at UCLA. I mean, our team is a multidisciplinary team. We have clinicians, we have curriculum developers, we have students, researchers, and I think with regards to our learning center, one of the things that we recognize is in doing the work, we are creating spaces that are accessible for people, sometimes beyond time. I mean, a simple fact is that, for example, before creative well-being workshops that we collaborate on, we have those workshops available live, but we also have them available asynchronously. And sometimes making the resources available to people where they're at is a very important component of the work that we're doing. That, if you can't actually show up in person, then we can do it online. If you can't show up online at that time, then we have it recorded. And while we have it recorded, we may have interactive activities for you to actually engage with the material in a way that you might have if you were actually in an audience. So I think for us, and our team is making the resources available in multiple modalities for our learners.
Thanks, Miguel. And I'll just briefly build on what you both shared, because our collaboration together through Creative Wellbeing is really a systems change effort. It's a county initiative in partnership with Mental Health, Department of Mental Health, Children and Family Services, Office of Child Protection, and the Arts for Healing and Justice Network. So it's really bringing county staff, artists around the table with community to build out an implementation model that's really about weaving healing-centered arts and mental health promotion together to have a parallel process that's going to serve the adults supporting the youth. We're especially prioritizing sites for young people impacted by systems or at a higher risk of being impacted by systems. So through this work, we are working to shift county systems of care to bring more healing and resilience. So it's been powerful partnering together because we've been able to reach far more people through our various initiatives that were already existing by infusing creative well-being into those and sharing it out, especially the virtual offerings of Wellbeing for LA, having sessions up there. So thank you. I'd love to hear from you all of how have you personally experienced healing through the arts? How about you, Stephany?
So, I mean, I think grief hit me, and I think as it has probably all of us in this very room right now. And I just couldn't wrap my mind around it. And I wanted to help my family members that were dealing with grief and loss. And I was like, there's no time for me. I need to focus on them. So I was doing research and how can I help them and what can I do? And when I was trying to explain that research and coping skills, I couldn't. I was very emotional. I couldn't get a feel for what was happening. And I realized I'm not really processing or dealing with what I did. And around that time, I took a writing workshop. And it wasn't for my grief. It was just because it was interesting, and I was like, this sounds like a good training, let's try it out. And it was so freeing and so liberating to just write down my thoughts and be able to rhyme. You know, and I still do to this day. I'm still writing things down when I'm feeling some type of way. I forgot about the rhyming. That's been gone and forgotten. But it's just still very great to just write down my thoughts. And I feel like when I was in the clinics and I did the one-on-one work, I saw that in my clients too. It was really hard for them to express themselves, to talk through things. And I would see them when they would engage in any type of art, that another side of them would come out, a different personality would come out from them. And I started realizing that I would have never seen that side of them if it had not been for them creating art in our sessions. And so, you know, and that beats traditional talk therapy in that sense, right? It's not for everybody. And just healing in my own and seeing it through other people's lenses as well. Yeah.
Thank you. How about you, Rebecca?
I'm gonna take it to, as a mother, I have 2 children, and my youngest, who's full of life, when he was younger, he had a lot of difficulty regulating, and I had to use my therapeutic hat, but I really realized that engaging him in art, engaging him in drawing his anger or feelings out, really seemed to like help him calm down and also connect, because when you sometimes, as a mother, and this is for me particular, it was really hard to not be able to regulate your child, and it does bring certain feelings for you. So being able to find something that we can both engage in those moments and do art together, it not only helped regulate him, it helped regulate me, but also it helped us have a more beautiful bond. And so at this moment, he's older, but he draws all the time, and he's extremely expressive. And I think about those moments when he was younger, I'm so glad I took on some of the art classes that I had taken. I think from even my own trainings, that from UCLA, COE, that it allowed me to be able to do those moments of connection with my child. And I see through my eyes, I see how he is now because I allowed him to do it that way. So yeah.
So beautiful. How about you, Miguel?
I think being in this space makes me think of music. My father was my best friend, and he had a stroke 10 years ago, an ischemic stroke. He was paralyzed on the right and unable to speak. Prior to that, he was very active, loved singing, totally geeked out on music. His record collection, I mean, everyone's in there. John Baez is in there, Simon Garfunkel's in there, Caribbean music's in there, and music was a big deal to him. And for him not to be able to speak was a big deal for him. But I noticed during the speech therapy sessions, the therapist actually started using music to help him communicate. And apparently, I'm not a neuroscientist, the side of the brain that allows you to speak is different from the part of the brain that you use when you're singing. And he actually was able to communicate through singing much more than he could through speaking. And in a very tangible way, music brought some of his communication skills back and also brought him, back to us. It's still a journey. He's still in the fight, 10 years, but music really has been an important part of his life prior to that, and instrumental in helping him, get through what he's going through right now with the recovery still ongoing.
It's really illuminating to hear how arts has shown up in different ways in each of your lives and really supported you and your families. Thank you for sharing. I'd love to go a bit deeper into this question of how are you seeing arts breaking down barriers in the community, such as in days like this, times like this? How can the arts bring people together? And how about Miguel, if you're willing to jump in again?
It's an interesting time to be talking about barriers. I would say that, arts breaking barriers is also arts building bridges. And I think neither of those things happen without empathy. Unfortunately, I think empathy is kind of getting a bad rap in some circles, but we can't go over what the challenges we're facing right now without it. And it's said that empathy is fueled by imagination. Empathy is a courageous act. It's a creative act. And I think over time, historically, artists have been at the forefront in basically using the arts to bridge conversations across ideology. So it's about the empathy.
Thank you. How about you, Stephany?
I agree wholeheartedly with Miguel. I think that we have so many different views, different beliefs and morals, or what have you. And I think we all speak art in some way, some shape or form. We all go see a movie and we're just like, this was great, right? And tell me about it. And I think that we put aside all that negativity and are able to connect in that moment, right? And we go see a concert together and it's like, that was so great, right? And we see outside of what's really happening in the world. And I think that art is just a common language. And I think that's what we can continue doing, speaking art language to each other.
Yeah, powerful. How about you, Rebecca?
I think I agree with both Miguel and Stephany, and art is a universal language. Art helps you build empathy. But in addition to that, just art, it has the power of bringing people together, different people from different walks of life together. And if there's anything that I've seen in my life that brings people together, it has been art. That's why we have places of congregation like, museums, concerts. They do bring people from different walks of life together. And during these times, I consider the times of COVID, when it happened, and we were thinking, it's just 5 years ago, and technology changed so much. I remember with COE having the conversation, how are we gonna have these workshops? You can't do this. And having online platforms, Zoom, really taking off, and Teams taking off at that time, and now there's so many others. It was a way of connecting people, and I know sometimes we don't see technology as art, but it is a form of expression of art, and it's just the connection between, you were able to connect and even play games in real time with family members from LA in New York. And I think during these times that were happening here, especially here in LA, my hope is that the arts can be utilized to help us come back together and see each other's sides without hurting each other, and I think if anything in my life, again, it's the arts have the power to do that. So it's more than ever, we need artists bigger than us, with more power than us, to be able to help and connect that for a whole community.
Thank you. I'm hearing empathy, connectedness, creativity, resilience, that we know we need more of this. And I want to help people continue this work. Can you share with us some elements that need to be present for this wellness through the arts? How about you, Rebecca?
Yeah. So in order, a lot of things have to be present. And sometimes it has to be the ability of the person, the openness. Sometimes there has to be fiscal, there has to be financial opportunities, partnerships. But I think what we really need is really an open mind, thinking outside the box. And again, I'm going to say partnerships. If it weren't for our partnership with UCLA COE, which one of the things that I would like to express is the COE has allowed us to talk about mental health in many different aspects. We have creative well-being there. We have Wolf Connection having some videos there as well. Communicate not just to our clinicians, but also to people from Department of Children and Family Services, from Department of Public Health, and many other nonprofits, or even our promoters programs. It's a way of like learning a new language of communicating about mental health, but also about what other resources are out there. So I think in particular right now, I really think it's open-mindedness and definitely partnerships. Because in order for us to think outside the box, I went to school for my MSW and we weren't never talking about art. You know, that was never a discussion. So in order to have this together, it's really the partnerships to continue so we can learn from each other.
Thank you. How about you, Miguel?
I'm glad Rebecca mentioned partnerships. I think I can only think of one, and it's about creating safe spaces and resources for art to get done.
Yeah.
And we need partnerships for that. There's a concept called food desert. You might have heard of it. I think, you know, food desert being like a community that doesn't have access to fresh fruits and vegetables. There's a direct outcome, like health outcome, when you don't have access to the right kind of nutrition. And I think there's a direct outcome when you don't have access to resources to actually create art. And a community that has those resources accessible to them and the space, a safe space to practice that, to collaborate, is very important. And I would say just that one, if I had to pick, I would pick having access and having resources to actually get the art done.
Yeah, absolutely. Couldn't agree more. And I think the thing I'd love to add in terms of elements is the healing-centered approach that is trauma-informed and goes beyond. It's some beautiful thinking coming from Dr. Sean Jenright and the Flourish Agenda that, healing-centered approach really starts with what's right with you. It's strengths-based. It's really just entering the conversation and building on what's there. And not worrying about any deficits. That's so powerful. And also centering relationships. In the partnerships, when the actual authentic relationship building is given space and time to really happen, it's amazing how that will carry a group through challenge, through pivots, through adapting to all the things that we are doing even today. So what if someone's not an artist? How can they nurture healing through the arts? What do you think, Miguel? I see you.
When I hear that question, I think, who isn't? I might ask all of you, anyone here was never a child? I think, as Rebecca mentioned with her own children, children are artists, and I think we've all experienced that at some point. And maybe we've gotten busy with life at some point where we don't practice it as much as we used to be a child, and I'd like to think I'm a forever child, but I think being able to tap into that child, and if you're not creating art, you are certainly consuming it. And consuming art is something I think we all do, and I would recommend we perhaps be intentional with the art we consume and find ways to think about, be present, whether it's a movie, it's music, who we're doing it with, what we're doing, and how it makes us feel. So even if you're not creating, I think you're consuming, and you can definitely think about ways in which what you consume and whom you consume it with, and how it makes you feel, and be intentional about it.
Thanks, Miguel. How about you, Stephany?
I would definitely say I'm not an artist myself, although my mom would say I'm a little dramatic, hence right now, right? But I think what we really need to do is just embrace it. Embrace the arts, welcome the arts in everything we do and everywhere we go, right? And so I think something I always think about is a teacher I had. It was a history teacher, and she made us draw a comic strip for World War II, and it stuck with me, and I learned it, and yet we incorporated arts into that, and I think that was amazing. And so I feel like that's something that we should all really do, right? Just embrace it, acknowledge it's there, and use it to our strengths, and really just go with it,
Thank you. All right, to close us out, I'd love to share for ourselves, for the community, for those listening, what are some actionable steps that we can take to move towards nurturing more community wellness through mental health promotion and the arts? How about you, Rebecca?
Well, I think, again, is really having an open mind and ensuring and remembering that there's always something we can learn from others and from each other. I think also partnering with others, I think it's super important. I can reiterate that more, because the reality is it helps you move beyond what you know. And honestly, also having, being willing to just learn from each other and from different aspects is very important in order for us to be able to create a more accepting environment and ensuring that mental health also becomes less stigmatized. One thing that I think about mental health and art that is very similar, I think, is that mental health is seen as something not important, not necessary. And a lot of times, so are the arts, right? When you go to school, for example, like, oh, why are you going to become an artist? Like, you know, like you'd rather go into becoming a doctor or a lawyer. A lot of times, it's almost like they're not seen as important as part of society. But the reality is that when by themselves, they're extremely important. But when they come together, they're extremely powerful. And I think you have to think, in order to be able to see it differently, you do have to have an open mindset for that.
Thank you. How about you, Miguel?
Totally agree with everything Rebecca said. I would say, as far as an actionable step, I think you're taking one right now, watching this. I mean, just being informed about what's happening in your community, and not just what's being done, but how it's being done, is perhaps a very simple first step in exploring your own curiosity, and then seeing what exists, and then picking from what you find exists, participating. So I would definitely say, by being here at this moment, watching this, you're taking a step.
Terrific. I do want to mention we have some resources that LA Opera has up on their website in connection to the summit. Miguel, do you want to share a bit about what is on the resource?
We have, actually, the LA Opera website has wellness resources, and I kind of avoided doing a shameless plug for the COE, but we actually have links to examples of our work on the LA Opera Resources website. We have examples of the work we've done with Rebeca and Stephany. We also have examples of other work we've done with other partners at the COE, and also creative well-being. So I would definitely go to that website. There's a link with tons of resources, and that you can start your search right there.
Yeah, and I'll add that we also have a resource page on the website for creative well-being and beyond. There's several healing-centered, arts-based resources and crisis response resources and different ways to connect. So hope you will check those out. We hope that you find your own way into this work and that you carry it forward in your community, for yourself, for your family. There's so much power here. I really appreciate all that was shared, and thank you to all of you wonderful panelists and to the organizers of the summit for this conversation.
Thank you.
Thank you.